Hi, I'm Stuart Ward, CEO of WardMM. We are a clinical pharmacist group that are prescribing decision support service. What we have is a wonderful technology that allows doctors to have that decision support pre-prescribing. We also have a high-touch service that allows consumers to reduce their risk against adverse drug reactions. We've just seen a way that we believe is a really good way to be able to reduce the medicines and offer it as a service direct to consumer.
I'm too sexy for my love, too sexy for my love, love's going to leave me.
Hi, I'm Stuart Ward, CEO of WardMM. We're a precision medication management company, and we tackle adverse drug reactions by optimizing precision prescription decisions for patients. Let me tell you a story about Mr. Bloomfield. He's an 80-year-old man, 4 medicines regularly, and on entering a nursing home, he was prescribed 2 drugs. That caused some side effects. A further 2 more drugs were prescribed on top of that, and unfortunately for Mr. Bloomfield, he suffered a catastrophic adverse drug reaction. What happened from there is he was hospitalised, and he later went and passed away, unfortunately. It's not an uncommon story for adverse drug reactions, and it's the 4th largest killer in the United States. The sad thing is, it could have been prevented. Now, in the case of Mr. Bloomfield, he would have had to have a pharmacist fill out a prescription. According to the Chicago Tribune, 1 in every 2 simple drug co-interactions are failed to be picked up. So unfortunately for Mr. Bloomfield, he was on the unlucky side of the coin. Now, this is a $1 trillion global business problem for pharmaceutical sales. And you can see from this, there's a very, very great opportunity to make a difference. At WardMM, we begin our solution with a clinical pharmacist collecting very important clinical information, such as DNA swabbing, clinical relevant information that a doctor takes in, and we enter it into our high-tech cloud application base. What happens from there is our sophisticated algorithms goes about calculating the most optimal medication for that particular patient and optimizes tune to that patient. This information is then reported to the GP or pharmacist, and they've got that information at that point to be able to make a decision. They can also change the information on the fly to get new variables and see what those medicines look like. And in the background, our database and our systems gets collected, it gets critically analysed, it gets critiqued and academically detailed, and the rules are then fed back into the system to create a continuous improvement model for that clinical model. All right, this is where we are currently. It's a visualization of some drug co-interactions that are dangerous, but at the moment, it's post-prescribing. So what we're moving towards by adding an artificial intelligence system gives us a pre-prescribing opportunity, which is a real game changer in the pharmaceutical support services market. At the moment, we've developed a platform and a foundation that will last for many years to come for this successful company so far. In under 2 years, as I mentioned before, the artificial intelligence build will actually change the game for pharmaceutical services support. WardMM is like no other. Our mix of superior academic capability and our unique platform allows us to be right now the most comprehensive service provider in this space in the USA and in Australia. We are using our expertise in Australia in older adult managed care to move into the US as a B2B, B2C model. And then from there, we stepping stone into suppliers that are reliant on prescription analysis, such as hospices, retail pharmacy, and hospitals. From there, we're working with larger health organisations, health plan organisations, such as AARP, to develop better health plan opportunities. We currently have, with our current solution and our clinical research element projects, have made $3.1 million over the last 3 years. We're moving into the US with an annual premium cover and a very unique pre-prescribing analysis system to enter the US market. Now from there's a bit of icing on the top, is that we've got the most comprehensive medical records that we can commercialise at $7 a pop. We're a mixture of clinical and corporate multinational experience, and that blend defines our success today. But it's great for it because it's a fantastic foundation to build on the future. We're first and foremost backed by our Australian government, which is fantastic, and obviously we're joining in with some very influential institutions around the world because we feel that we can make the most impact on eliminating medication-related harm. We're asking for $850,000 US as a seed round, and the Australian government will match about $650,000 of that. So it goes a long way. We'll build out the tech, and we'll also launch our sales and operations right here in Houston, which will be fantastic. Join me in ensuring people feel their best every day by ending medication-related harm. I'm Stuart Ward, CEO of WardMM. Thank you.